What brought me to this health system was when I got out of college, I had met a group of 3 gentlemen that were from the Brunswick area. And we all became best friends, and my roommate in college actually married one of these gentlemen. And they moved back to Brunswick, and she called and told me there was a job opening in Brunswick, and she knew how much I loved the beach. So I came down and applied, and at that point in time, I had had some major mouth surgery, dental surgery, and my jaws were wired shut. So I could not communicate with the lab director during my interview except by writing things down on the piece of paper. I still lacked taking the test to get my license to be a medical technologist. And she told me that she was offering me the job, but she wanted to wait until I could actually talk to her and I had passed my test. I started working in the laboratory on night shift, and then I became night shift supervisor. And then I left night shift and went into microbiology and worked in microbiology for many years before I took an LIS job in the laboratory, which is a laboratory information specialist. And I took care of all their computer stuff until I moved to information systems in about 2009. When I came to work here, and it was Glen Brunswick Memorial Hospital, we had a wing that was called the West Wing. It was 2 gigantic trailers that had been put side by side that had about 40 patient rooms in those trailers. And they were adjoined to the hospital by a walkway, but they were separate trailers like you would see at an elementary school, you know, when they've had to outsource space because they've outgrown their space. But shortly after I came here, when they were doing the construction, part of the construction was to be able to get rid of those trailers and make inpatient rooms in the new towers that were built.
Well, I would say Ann is always lending a helping hand. It doesn't matter what the job is within our department. She's always the first one to say, what can I do to help? You know, do you need me to come in? Do you need me to do this? Do you need me to do that? And she's always very willing to help, you know, her team members and everyone else around her.
And she's been in our department 13 years now. She came to us from the laboratory. She's always given 110% of herself and always is focusing on the ultimate goal of the care of our patients at the health system.
A good word for Ann is volunteering, whether it's in our department, whether it's for the health system, whether it's for the community. Ann is known to volunteer to several events that support our patients and support our community, from the bridge run to the shrimp and grits to the whiskey, wine, and wildlife. She's always volunteering and always recruiting those of us to come help her, and she has a long list of things that we can do every time that she recruits us to go volunteer at one of these things. But I think that's a good way to describe Ann, is her commitment to our organization and to our community.
I would call her the sunshine chairman of the Information Systems Department. She's always one of the first ones to want to organize a lunch when we could have lunches pre-COVID. But to sum her up, I'd say she's a nut.
Well, I feel like we've kind of grown up together professionally. So, you know, it's nice to know that you have a team member that you're familiar with their family and their children and that type of thing. So it really puts you on a very intimate level with them. There are a lot of funny things that I could reminisce with Ann about, but none that I could definitely put on camera, because she has some hilarious stories that she's gotten herself into that we've all enjoyed listening to over the years.
I remember going to a healthcare conference in Kansas City with her, and this is back when I had hair. And three of us shoved ourselves into a photo booth and took some of the little airport photo type things, and I still have that picture in my office.
It's enjoyable to work with someone who gives that much of a commitment and who is that patient-centered. That's what we're all here for, is patient care. And I think Ann exhibits that very well, and something that we should all be proud of and should all emulate.